I think it provides an extremely clear understanding of distress. I don't need to read books in order to understand what people are telling me, because when people tell me about rape and sexual abuse and physical violence, I know what they're talking about.
I think having had an experience myself and working through that, I think it's just given me that greater understanding that my training just wouldn't have given me.
I've worked with the Trust for 10 years now. I actually applied to work for the Trust knowing that if the service that were looking after people with mental illness couldn't look after their own people with mental illness, then we were in real trouble. So I consciously made that decision to work for the Trust solely for that reason.
Until you've been suicidal, how can you understand what it's like to be suicidal? The peer support workers that have come in, I think are very brave in sort of being quite open about their lived experience.
I've had a very particular lived experience, and that is that I've had somebody very close to me commit suicide. And that's given me more than a professional view on what they might be feeling. I mean, we're all different and we all feel things in different ways. But I would say it's really increased my empathy for people. I'd also say that actually, I think it's given me more emotional depth just as a person, which impacts on how I do my job every hour of the day.
No, I think there's still a massive stigma that people do feel as if they can't say anything, and I think in this environment that's really sad.
Well, it would be good to have less stigma in the workforce. Colleagues who have mental health problems either go to different trusts in adjacent areas to get help or go privately. First line is to look after yourself and to try and work with your own problems.
I don't think it's commonplace, and I think there's lots of people still feel quite stigmatised and worry about how people will perceive them and what people will make of them within their role. So are we using it effectively? Quite probably not.
Half of my colleagues don't know I've lived experience, and I would not be inclined to tell them, not because I don't think that they necessarily understand, but because it just doesn't feel comfortable. And so if we're not sort of disclosing that we have lived experience, how can we be utilising it and how can we be taking advantage of it? So I think it goes back to the training. If we can start to instil that when students are coming through on placement and in their training, then hopefully that will come through to the workforce.
I was managing an area, and I would suggest that nearly 50% of the workforce there actually had some form of mental health need. I really didn't want people to know that I'd been unwell, because I'm a mental health nurse and it doesn't happen to me.
My lived experience occurred at a time of physical health problems as well, and I think my employers focused very much on making reasonable adaptations to meet the physical health difficulties I had. But even to say we're a mental health service, trying to get them to make adaptations that meet the mental health needs I had has been quite difficult. As I say, I've not told a lot of my colleagues that I've lived experience. They know about the physical health problems I've had, but they don't know about the mental health difficulties I've had.
Try as we might, and this is a good organisation, but try as we might, I think our society still tends to have an us and them, a well and sick, and our organisation it is no different to society in general. I think that's an interesting and probably the most important question. People are not perfect beings. We struggle from time to time, and it's about keeping that conversation going, and it's about continuing to break down the us and them between staff and service users, because actually we're all just people at the end of the day in different parts in a system. I don't think there are any secrets as for how we break those barriers down and how we make this work easier and better, but I'm convinced we do need to make it easier and better.
I think that there's got to be a culture change. I think that as an organisation we need to be saying quite clearly to staff that it's okay. But I think we also need to be giving some guidelines as well to staff, because I think that there's still quite a concern out there about what's appropriate disclosure and what isn't. We need to look at how we harness those lived experiences of staff. Disclosure is a very difficult issue to get into. However, I think we need to have those conversations, and I think we need to challenge ourselves with that.
I guess as well some idea about the boundaries to try and keep, because I think there's sometimes a risk of oversharing with patients, or making yourself vulnerable, or taking away the focus from what their needs are and turning it to your own.
If you're an OT doing training, we're taught quite extensively about the therapeutic use of self. And although you may not have mental health difficulties or have had mental health difficulties, you're still a human being. Other professions are taught you don't do that. Under no circumstances. There's an absolute boundary between who you are as a human and who you are as a nurse, for example. And I think we need to remove that boundary. I think we need to start accepting that we're all human beings. We all have problems, whether they're mental health problems, social problems, or anything. And actually, if we want to work more effectively with our clients, that relationship is only going to be enhanced by accepting the fact that you go into there with things going on in your own head.